Good morning. Today is the 12th of December, and I'm going to talk to you on money and Medicare. It was 2006. My son comes to me and he says, I want to open a radiation center. I said, okay. And he wanted me to go and do the research. He said they are doing what we call radiation on prostate cancer, and Medicare is paying close to about $50,000. They already had center what we call oncologist, cardiologist, family practice, and so on, and he wanted to add this. I say, okay. I went to local doctors, that is in Newport Richey and Zephyr Hill and in Tampa, who was doing a radiation therapy for prostate cancer. After visiting each one of them, I found out that they were giving what we call 25 to 30 treatment, that is for prostate cancer, depending upon their stage. And I was so surprised, and I start talking to the patients what are their complications are. Every one of them had a complication, but it was all money oriented. And I said, because I already practiced in 1980 to 1984, where I treated prostate cancer and prostate enlargement, and people can live their normal life. Unfortunately, this was all related to Medicare, money-making machine. The doctors are also a little bit confused, but they were not that way conscious, because they're also trapped into what we call conditioned unconsciousness. And they were doing it because Medicare was paying it. And how it is started, because they somehow many years ago, they started with a seed therapy, then radiation, small radiation, and then they start going in major radiation and so on. And now, at that time, though, I went back to my son and I said, look, this is not right, because you don't want to put a radiation therapy. And at that time, I started looking back into the urology, especially on prostate cancer. And I wrote a book at that time, 2008, called the Kama Sutra Yoga. And in that book, I wrote a chapter called the Pillar of Life on prostate. And it was amazing, my research, I found out that this is all done to get the material thing, to do the material thing on the prostate gland and to take money. And that is why the Medicare has gone so far in a crazy way, because everybody is trying to do a material way to work on this non-material body. But it is not actually anybody's fault, but unfortunately, they are all trapped with a conditioned unconsciousness. Anyhow, after finishing the book, I was now got so much concerned about the prostate, and I then started working on what you call another book called the Prostate Cancer Awareness, which I'm going to up to date before I leave from here, from Levana Cyber Height. But I want to tell you that how the system got buckled up, and it is because of the conditioned unconsciousness, because we are living not consciously. We are not working on that patient consciously. And I'm very happy that I am out of that medical business, and now I'm sitting here today at Levana Cyber Height, and I finished the book called the Cure Cancer at Home Naturally. And I request all of you to get this book from Amazon Kindle or from a website. Read it thoroughly. And there's a chapter in this, Cure Prostate Cancer Without Robotic and Surgery or Radiation. There's also a chapter called the No More Breast Cancer. Please read this chapter and work with your health practitioner. so you can get the best result. I wish you all a happy day, a healthy day. God bless. Namaste. Amen.